All right, and we are back for another episode of We Good. It's the virtual town hall series hosted by the African American Leadership Forum. My name is Brittany Wright, and it is a pleasure to be joined in virtual space with you all again. On today's town hall, we're focusing on COVID-19 mental health and how to cope with everything that's been going on in our world, in our news, and in our communities. On today's particular town hall, we of course are joined by Miss Adriene Thornton, who is a nurse and infection preventionist with Children's Minnesota. Welcome, Adriene. Thank you for always being here. Up next, we have Sam Simmons, who is a behavioral consultant and also a radio host on KMOJ. Welcome, Mr. Simmons. Thank you for being here. Also joining us is Dr. Zakia Robbins-McNeal. Many know her as Dr. Z. Welcome, Dr. Z. Thank you for being here. And last but certainly not least, we have Brandon Jones, who is an integrated services manager at North Point Health and Wellness. Thank you for being here. Good morning. So our panelists are working in health in some way right now and helping us maintain our lives during a pandemic, during an uprising, and during just an overall unprecedented year of many sorts. But to ground us in all of this, first, why don't we go ahead and do an update with Ms. Thornton on COVID-19. A lot has happened in the news. There's always stuff in the news, but this particular town hall is unique because since our last town hall, not only have the numbers continued to go up in many states, but the President of the United States now has been diagnosed with COVID-19. So help us wrap our minds around where we are and how we got here.
Right. So, when we started to open the world back up, we knew that there was going to be a lot of risk of increased spread. So from an infection prevention, infectious disease standpoint, none of us are surprised about the increasing numbers. We knew it was going to happen. Dr. Fauci warned against reopening things too soon, and his warnings were not taken seriously. And so this is the result. You have more cases, you have more deaths, and you have an out of control situation. And, I kind of want to frame the picture because I know that there has recently been talk from the president about COVID-19 not being as bad as flu, and it's just like the flu, and he beat it, but there's a lot to unpack there. But I want to frame the picture for everyone so that you have a clear understanding of the impact that COVID-19 is having on our world. So from a United States standpoint, we're up to over 7 million cases of COVID. That's just today, over 7 million cases. That is more than all of the influenza cases for the last 7 seasons. So if you go back to 2014 and you add up the number of flu cases for every season up to now, we still have more COVID since March of this year than we've had influenza for the last 7 seasons. That is unheard of. That is a lot of COVID, and that is a problem. We have, in the last 7 days, had 306,000 cases of COVID. So I want you guys to sit back and picture this. You go to the city of St. Paul, and it's completely empty. The entire city is desolate because that entire city has been impacted by COVID. There are 300,008 people in St. Paul. In the last 7 days, every single person in St. Paul, the same number of people, have developed COVID. An entire city. That is a lot of COVID. That is not good. We're going in the wrong direction. And for deaths, we're up to 206,000 deaths. 206,000. That's 200,000 people who will never celebrate their birthdays or anniversaries or be there for their families. That is a lot of people. And if you look at it compared to influenza, we only had 50,000 deaths related to influenza since 2014. So that's 7 seasons of influenza is about a quarter of the number of deaths related to COVID. That is huge difference. That is not okay. It is not the same as influenza. It is not just as bad as influenza, and you're not necessarily just going to beat COVID-19. It doesn't work like that. That's not how this virus works. We don't have a vaccine for it. We don't have a known treatment for it. With influenza, we have drugs we can treat it with. We have a vaccine to treat against and prevent it. We don't have any of that with COVID-19, and we're still learning about the virus. So we're still learning how to prevent it, how to control it, how to help people get better from it. We have people in New York that had COVID-19 in the earlier days. They are still suffering from neurological issues. For instance, there's a nurse in New York that had COVID back in early March. And now that she's so many months out, she's still having issues with memory and remembering simple things like how to sign her name on a check. She was at a grocery store and she could not remember how to sign her name on her check, so she had to have her husband do it. And this is months after she has recovered from COVID-19. So we're still learning the long-term impacts of COVID-19 on our bodies and on our minds and how we're going to deal with this going forward. Now, looking at the data from Minnesota, we are up to 106,000 cases. So that is about half the population of St. Paul, about a third the population of Minneapolis. So take you and two friends, one of you has COVID, essentially. That's what it adds up to. If you look at the populations of different cities, you look at Brooklyn Center, they have 30,000 people. So with these 100,000 cases, we have multiplied the number of people in Brooklyn Center that have COVID by 3. For Brooklyn Park, it's 80,000 people. So that whole city has COVID, plus about 20,000 extra people. That is a lot of COVID in our state. That is too much, especially when we have known preventative measures that work. For deaths, we're up to 2,000. So you figure that is 2,000 people in Minnesota who won't be able to enjoy our lovely snow. That's 2,000 people who won't be able to support our Minnesota people with their working and with their passion and their love. That's somebody's loved one. That's 2,000 loved ones who are no longer here to live life with us. That is a lot. That is too many, and it's preventable. We can stop the transmission if we just follow the guidelines. So it's very disturbing when you have someone saying that they beat COVID-19 and you can beat it too, and that, and then taking off their mask irresponsibly and presenting this picture that it's okay to continue doing what you've done all along when we know that that's not okay. It is not okay. It's not right. It's an irresponsible message to share with the world. And what I want my people to understand is that you have to do the right thing even when you don't want to. I'm there with you. I am tired of wearing masks. I am so sick of wearing masks. I bought several to coordinate with outfits just to make me feel better. But like you, I'm tired of wearing masks. I am tired of worrying about my children getting sick. My son is a special needs person. He basically has no immune system. He had COVID pneumonia in July. I have no idea how, because I kept him in the house starting in March and only took him out a couple of times to get a haircut and to go to Target. And that was it. He had on the mask the entire time. He still got COVID. And my daughter and I were negative. So he didn't get it from us. So he got it from somewhere in the public, from somebody being irresponsible and not doing their part to protect my baby. I'm tired of worrying about my daughter in college. She has a COVID plan for her and her roommates, but that doesn't mean her roommates are going to follow it. And we know that the college students are partying. What does that mean for her? She still has to go to school. So I understand people's frustration. I understand that they're tired of doing things. We're all tired. However, this is what we have to do to protect ourselves and our loved ones. And until people get on the same page with doing what's right for everyone, we're going to continue to see increases in numbers of COVID cases. We're going to continue to see increases in death, and we're going to continue to see long-term impacts from this disease that we could have prevented.
Well said. You brought up a few important points that I want to touch on. First, Mayor Keisha Lance Bottoms down in Atlanta, she tweeted a couple weeks ago that her husband had COVID. And even though the COVID, you know, he's been cleared, he's not in the hospital or anything like that, he still has debilitating headaches. And it's been a significant amount of time since his actual diagnosis. You know, he's not transmitting it, you know, he's not contagious or any of those things, but still has life-altering symptoms. My cousin is another example of that. He also contracted COVID, and it's been about 3 months, and he still has a horrible, very painful and disturbing to witness cough. And there's nothing that he can do to get rid of it. And so I think that's something for people to realize, is that there are the initial symptoms that you experience. There's a period of time in which you have to quarantine, but just because you get cleared and you're no longer contagious doesn't mean that you're not going to still feel the impacts of the virus. And we've seen, and it's been confirmed, that there were certain people, public figures, who downplayed the importance of COVID, and we're seeing it still happen in real time. And a part of that, I feel like, starts to cause a little bit of hysteria, because it's like, well, what's true? What's not? Who can I trust and who can I not trust? So I want to ask Dr. Z, as a therapist, and you're someone who people come to when they have anxiety about COVID or about just all of the extra precautions that they have to take in living in a pandemic, what advice do you give to your own clients about how to deal with either the COVID fatigue of like, I'm sick of wearing a mask and I want my old life back, or I am incredibly anxious and worried about my elderly parents? Like, what advice do you have for people who have this looming COVID anxiety hanging over their heads?
Yeah. So, I mean, I can say that, you know, even though I was, you know, working with clients prior to, you know, dealing with COVID just increased. If you had somebody that was already anxious and already nervous and already worried about what they could not control, this just heightened it, honestly. Some people had a really hard time with even thinking that they could cope, you know, after being in the house for, I mean, I want to say we're at like 6 months now. Some people still have not gone outside, or they have limited their outside interaction. It's taking a mental toll on everybody. Even if people were not anxious before, they are now, because now you have another thing that people cannot control. You cannot control whether other people wear their masks. You cannot control how other people choose to care or not care, or limit their interactions, or like you can't control other people's doings. However, how do you sit back and not take it all in? Because it is hard. You know, I'm glad that Adriene did bring up some of the things that I often hear a lot. It's like, people, sit down, stay in the house. You know, we need to do this. And we're a very selfish society, sad to say. If it's not impacting me or my family, I don't believe it, or I don't really care about it. That might not be the entire thing, but it's like, if it hasn't happened to my family, then it doesn't impact me. Some people don't believe it until it actually impacts them and their family. You know, COVID is out here. COVID is real. People are dying. You see the RIPs coming up. You know, this person died, this person died. We see that people are dying, and then it's like, poof, gone in the wind. You know, I care today. I might even care 2 days later, but then it's like gone, because it hasn't negatively impacted people to the point where, you know what, I'm gonna stay in the house. I'm just gonna make, you know, I'm gonna try to do what I can for this world. I'm going to stay in the house. But for the people that are on the other side, it's just like, gosh, will you please just sit still? It's hard to control what you cannot control. You can't control it. A lot of the work has been placed on, or what I've been doing is, how do you cope? How do you control what you can control, and let other people do what they feel they need to do to operate in their own lives? We can't control them. That's the bottom line. We have to learn to come to terms with that. You can't control the uncontrollable, which is other people and their actions.
You know, that's a really great point, is that this is, I think, for some of us, the first time that we're coming in contact with our limitations, or at least that's how my therapist has presented it to me. Of suddenly I realize, you know, I can control what my family eats. We can eat all the freshest organic vegetables and we can be vegan. We're not, but we could be. You know, we can do all that we want to do to control our health. But when we step outside of this house, if someone is choosing not to wear their mask or not to practice proper hand washing or whatever it may be, that's out of our control. And suddenly our health becomes at risk. Something that I am navigating right now is, do I put my child in daycare or not? The daycares are open. You know, there are procedures, but can I actually trust that those other parents and those other young children are going to be doing their part? And it really feels like we're in just like a horrible group class project right now to beat COVID. And right now we've got a lot of classmates who are not doing their part, unfortunately. And that's, you know, the reality, and it does impact a lot of people's mental health. And I want to ask Brandon, you know, we talked about the media sometimes downplaying the implications of COVID. When that happens, it's kind of like a gaslighting, right? Like, we know that there's this thing that's happening, and then there's someone in a position of power actively saying it's not happening. When people are receiving mixed messages in the media, how can they navigate in a healthy way and keep sane when they're experiencing one thing but maybe being told another?
Absolutely. I think one of the ways in order for us to do that is to be able to use critical thinking skills and make sure that we're taking the best possible care of ourselves, no matter who's showing us things differently. And unfortunately, when we do get those mixed messages, people start to not believe in the statistics and things that we've heard earlier today, and they just go about their day to day as if nothing is happening, which is something that I have seen, particularly in our community, where folks are not wearing masks all the time. They're just going about, their normal day to day, doing their thing. And it's like a pandemic isn't even happening for some people. And that is dangerous because people are dying, people are getting sick. And then there's other, underlying health conditions and things that are also going on at the same time. And if you're not protecting yourself and you're not doing what you're supposed to do in order to, maintain health and maintain a state of wellness, then other issues will come aboard. And we already are dealing with a lot as it is. COVID-19 is one of many things that we've been addressing locally here in the Twin Cities as far as it comes to how well our community is doing.
Thank you. For the people who are staying inside, for some it's easy. It's like, hey, if you're an introvert, I want to be inside my house. For other people, they sometimes needed the outlet. They sometimes needed to go into the office. And what we're seeing now is that there has been an uptick in domestic violence cases, especially during the shelter-in-place order. And so I want to ask Mr. Sam Simmons, why do you think this pandemic has sparked an increase in domestic violence? Is it that it's just now being reported more because people are at home more, or is it the shelter-in-place order and just the idea that we should be spending more time in our homes that's causing more internal conflict between partners? What's going on there?
I think the easy answer would be all of the above. Okay. Because the thing is when we talk about domestic violence in our community, I don't think we really ever took it seriously enough to really address it to start with. See, the interesting thing, the thing about COVID that's interesting is everything that was wrong, the cover came off. It's almost like Mother Nature is saying, well, y'all want to deny all this stuff going on, so I'm getting ready to show y'all for real that y'all can't deny this stuff no more. In terms of health, in terms of abuse, in terms of oppression, all of these things that we in our community, we can't ignore, we see all the time. And now all of a sudden it's surprising to other folks. None of this is surprising to me. And so when you're talking about domestic violence, unfortunately, we don't, the system has never really wanted to take a real look at how domestic violence looks different in our community, especially parts of our community, in terms of the historical trauma, in terms of how we've been dealing or not dealing with our trauma and just going, rolling with the punches. We're, you know, we want to talk about resiliency and that kind of stuff. And, you know, my work around historical trauma has been, at parts of our community, been very rejected because we don't want to have that part of the conversation. You know, we'll talk about what has happened to us, but we won't really talk about how that has affected how we deal with each other and how it affects our relationships. And so I would get the pushback about resiliency. No people are supposed to be resilient for 400 years and not get no relief, right? So when we talk about domestic violence, we have to be honest about the sexism in our community around Black women. Black women have been set up from day one to be accountable for everybody but themselves. You know, I mean, the issue was always been surprising in doing the domestic violence work. I remember the first time I got a call from a domestic violence shelter, okay? And the woman calls me and she says, "Mr. Sam, I hear you the trauma man for men." And it's like, because, you know, folks give you all kind of names. And I said, I guess, what can I do? Now she in the shelter, right? And the father of her kids is, you know, he's down as the perpetrator. And she says, "I'm not necessarily trying to get back with her, but the father of my children has demons." And that's our way of talking about there's something going on with you, right? And one of the things about our relationships, especially as Black men, one of our most vulnerable times is with the person that we have our sexual relationships with, unfortunately, right? And we'll say things that they won't say to nobody else. And that's the person that hears about all our trauma, you know, and don't know what to do with that, and might even laugh at you, which is the worst thing you can do with a Black man in his trauma. Actually, anybody in the trauma, but especially a Black man in his trauma. You know, I done consoled myself with you. Now, granted, I done a whole lot of dog stuff to you already, but now you supposed to really, really care, have all this caring for me and that kind of thing. So you get this catch-22 with this Black woman who done seen that his behavior, his abuse really is not about her. That don't mean that she shouldn't do nothing about it. That don't mean she shouldn't go on and get her life right. She might need to leave and all that, but she been around him enough to know it's about a whole lot of other stuff at the same time. Then you have the issue of, I am not comfortable calling the police because, you know, in some communities, they used to call the police just to get the man out the house. We know when the police come to our house, it ain't gonna be like that, right? So dude who, you know, done find him a job, who got a job and whatever, if he go to jail, he gonna lose his job, right? And that kind of thing, which is gonna cause us a great deal of problems in the house. So what does that have to do with now? Well, she has no break. Everybody's stuck in the house. And we know with just the most healthiest relationships, the frustration of being around people 24 hours a day, and you ain't used to being around them 24 hours a day, that not only include our partners, that include our children. So, you know, all of that intensifies that. Then on top of that, you have the reluctance to call the police. And now we got this, you know, this boycott going on. Nobody wants to say that with the police. So even if you call them, they ain't coming anyway. So all of this COVID has intensified stuff that's already been in existence that we don't have enough real conversations about, other than what somebody else is doing to us, not realizing that our trauma has put us in a position where we have been doing stuff to each other as a result of this trauma we deny to address. Because one thing about trauma, if you deny your trauma, you deny your humanity, because everybody hurts.
There were like 5 different quotes in there. We're gonna chop up this conversation and play it back. You hit the nail right on the head. One of the things that you said that resonated with me so deeply is no group of people is supposed to be resilient through 400 years of trauma. And I think that's an important thing to state, is that We're not just dealing with a pandemic and figuring out how to navigate a pandemic. We have 400 years of systemic oppression and ongoing trauma on a daily basis. And particularly in 2020, you know, we've had George Floyd, we've had Breonna Taylor, we had what happened in Kenosha. It's been all over our news, all over our country. We've had this uptick in community violence that's impacting our families, that's impacting our communities and our friends and our social circles. And we're navigating all of it at once. And it kind of feels like, well, what is good? How can we possibly move on and be healthy? And I've seen people in this year, specifically in 2020, that have had a really hard time coping, that normally are super cheerful and resilient and are able to push through. And so I want to ask Dr. Z, when you've suddenly noticed that all of these things are suddenly weighing on your spirit, what do you do about it?
All right, that is a great question, because, you know, we are all in it. You know, we might not be experiencing.
I think we lost Dr. Z. While we get her back in, I want to go ahead and touch on something else that Sam Simmons talked about as it related to domestic violence. He was talking about the experience of Black men. And there's the 400 years of trauma, as well as, you know, other things, maybe childhood trauma or other things that they're dealing with, the quote unquote demons, right? And I'm curious to ask Brandon Jones, where do Black men get to deal with their demons? Where is that space? You know, because we don't even want to call it a mental health illness, right? So where do Black men go to safely and effectively deal with their demons?
Yeah, well, typically we don't go anywhere. We keep these things internal, and we address them through bottles, through marijuana, through sex, through violence, whether that's hard violence or soft violence. And the difference between those is it a physical violent act, or is it, you know, gossiping, talking about somebody, cracking jokes on somebody? That's more soft violence. So typically they stay internal. Now, we have had traditional places where that violence has been, or not that violence, but that being able to talk about that vulnerability and trauma can go to. Sometimes we have those relationships among peers, among other male members of our family. Sometimes we talk about them with our girlfriends or our partners, as Sam was saying earlier. And, you know, the barbershop has been one of those classic environments where we can talk about things, but we don't always talk about those things completely. We only give a little bit, because that vulnerability, being able to be raw, open, and honest about what's happening, is a very dangerous place for many Black men, because there's a lot of shame behind that. Now that somebody might see me as I'm weak because I'm sharing, you know, how I feel about a situation or how I've been affected. So typically what ends up happening is we keep these things inside, and then they manifest into other problems later. And, you know, that's one of the things that we have to be able to work on, and creating space for Black men to have constructive dialogue where there's not a lot of shame, guilt, or embarrassment around it, so that we can be able to support one another and understand that that's okay to support one another when we need help.
It's incredibly important. You know, I feel like, especially within the Black community, up until more recent times, we didn't really want to even address mental health, right? It was all, you know, don't put your business in the street, or just pray about it. You know, and as someone with two grandparents who are ministers, I'm all for praying about it. And also, I had a wonderful conversation with my therapist this morning, as I do every Wednesday morning, you know, and I think it's okay to do both. And we need to be able to normalize, especially within our communities and especially within our men, that there is nothing wrong with getting help outside of yourself to navigate the complex experiences that we're facing in our everyday lives, on top of the compound trauma and our historical trauma. I see Dr. Z is back. I'll re-ask that question in just a moment, but while we're still kind of talking about domestic violence, do you want to share where people can go if they find themselves in a domestic violence situation and want to get more resources?
Yep. Okay, I'm back. I don't know what happened. So right now, actually, the Minnesota State Domestic Violence Coordinator for Zeta Phi Beta Sorority Incorporated, we are in the process of compiling a list of organizations in the state. It's a statewide initiative for people to be able to go to, especially right now, people of color, honestly. But it's not limited to that. However, we want people to know that there are resources out there. on our website. We are going to be able to post that soon. And our goal now is to actually help support some organizations that cater to our community. So you can look forward to that as well. But right now we have a list of about 40 organizations that people can go to. And I would love to share that with you later, Brittany. The list format would be better.
Yes.
There are resources out there for people to go to for support and assistance, and if they need to get away from a domestic violence situation.
That would be amazing. I'll shout out Naomi Family Services. They've got a special place in my heart. In fact, my mother and I stayed there when I was a small child. My biological father was abusive, and we ended up staying in that shelter for a little bit, and it was a life-saving experience and a very humbling experience. And so I do want to say to anyone who is experiencing domestic violence, even if there are children involved, it's okay to get help and to leave that situation, and there is absolutely no shame in doing so. I'll make sure that we check back with Dr. Z to get that full list of resources, and we'll make sure it gets in the comments so that when you rewatch this conversation, you have those resources. But before the audio went out, Dr. Z, we were talking about how do you cope and how do you become okay with not being okay. There are people who were, all sunshine and rainbows up until 2020 hit. And now it's like they're the Eeyore of their friend group, right? They're suddenly a little lethargic. They're suddenly a little sad, or maybe they're angry, and rightfully so, especially as Black people. We got a lot of reasons for us to be mad. If you are noticing an internal change within yourself, what can you do about it? And do you do anything?
Yes. So look, I'm going to raise my hand because I was that person. I am the voice of reason, the voice of positivity, the finding the silver lining in everything. However, it got very heavy, right? So we're the ones we have to maintain our stature. We are the voice of reason for a lot of people, whether it be our friends, our family, the clients that we service. For me, I'm a professor. For my students, I felt like everything got heavy to where it was just like, well, wait a minute, I'm experiencing this too. I did not give myself the space to experience it. I just kept trying to help other people. I hit a wall, and it was just like, you know what, Zakia, what would you say to your clients? It's okay to be vulnerable. It's okay to not be okay. Step back and reset. What is it that you need? That included, honestly, like shutting down and coming back into myself to kind of recharge my battery, taking time to do some self-care. That meant, group threads, group chats kind of went to the wayside. Social media, getting off of that because that became very heavy. Not being as helpful to other people so that I could recharge my battery, because I am no good as a therapist, as a friend, as a wife to anybody if I'm not taking care of myself. So a lot of time and energy was spent into that, was spent doing that, and that is what I would recommend to anybody in that situation. It's okay, find a trusted confidant, get yourself a therapist. Having a therapist is not a bad thing. It's a great thing. It's an impartial person to help you navigate life as it is, in your own space, because we all have our own, issues that we need to deal with. So be okay with not being okay and getting the help and support you need, and take care of yourself so that you can better take care of those around you.
That's a really important point about a therapist being, a neutral party, someone who's not going to judge you or have bias or hold any of, your secrets against you, but is really there to help you navigate through. And that can look a lot of different ways, and for other people, therapy is not their thing, and that's okay. I know for myself, I love therapy, but I also love to travel. Just getting out of my traditional space and seeing something else can sometimes just like completely alter my mood, kind of give me a reset and a fresh start. So I want to ask Adriene, is it safe for me to continue traveling given that the numbers are going up, given that we are either in flu season or approaching flu season? I'm turning 30 soon. I'm trying to go on vacation. What is your recommendation?
So here's the thing. When you think about travel, for instance, I like to go to Florida every Thanksgiving. That's what our family does. That is my reprieve. And people are like, oh, well, I wouldn't go to Florida. They have so many cases. Florida doesn't have a lot of cases. The people in Florida have a lot of cases. So if I go to Florida and I stay away from the people in Florida, then I will be safe. And so what we do is we always get a home on the beaches, because it's 5 siblings and all of our kids. We'll have a private house on a private strip of beach, have our groceries delivered, but even if we go out, we'll still wear our masks, wash our hands frequently, and watch our distance. The same thing that you do when you're here in Minnesota, you can do other places. You just have to be safe about it. When you get on the plane, keep your mask on. You know, they'll give you a little baggie with a snack in it. Do you really need to eat that snack on the plane? I wouldn't, because you have to take your mask off to eat it. So unless you absolutely have to take your mask off, keep your mask on the entire time you're on a plane. If you're in a car, of course you're safe because it's you and your family, but you have to be aware of stopping at gas stations and going to restaurants to get food to eat. And so it's the same principles no matter if you stay home or if you travel. Wear your mask, wash your hands frequently, and watch your distance.
Got it. Okay. So let's say that a person travels and they do contract COVID. Can you walk us through the steps of contact tracing and why that's so important? The reason why I want to ask this specifically is because, you know, in the news right now, our president has COVID, but doesn't want to comply with the CDC. And
right.
So that's not necessarily helping in tracing, you know, everyone who could potentially have been impacted. Can you talk to, once a doctor diagnoses you, why you get that call from the CDC and kind of what that process is after that?
Right. So who the call comes from depends on who you are and where you are. So for all of our Minnesotans, if the Minnesota Department of Health calls you, please answer your phone. We are struggling with getting people to respond or answer their phones when they call. And so once we know you're positive, let's just stick with Minnesota because I think it's a little bit easier to wrap your head around that. For instance, well, even with the president visiting here, so what happened is once they found out that he was positive, they looked at, first of all, the date of his test date. Second, we look at the symptoms. And so when did he start having symptoms? When did he test positive? We look at the 2 days prior to his first time having a symptom. So if he had a runny nose or a cough or a fever, we would look at the 2 days before that and do contact tracing on everyone that he came in contact with those 2 days. So for instance, he was in Shoreview and Duluth a couple of days before he tested positive. The Minnesota Department of Health is trying to reach out to all of the people that attended those events. And it doesn't mean that they necessarily were exposed, but we can't determine that unless they have a conversation with them. And the conversation will circle around what kind of contact they had with the president or with any of his people that have since tested positive. Did they notice any symptoms? Were they wearing a mask at the time? Was the contact more than 15 minutes? Because the CDC has said that in order for you to be considered a high-risk exposure to coronavirus, to COVID, it has to be 15 minutes or more. So if it's under 15 minutes, there's not no risk, but it's low risk. And so if you're asymptomatic, you had a low-risk exposure, they'll tell you to do a symptom watch and quarantine for 14 days. They may or may not test you. Usually, if you're asymptomatic and you're doing fine, they'll wait to test you until you're symptomatic. But within the first 2 days after the exposure, the likelihood the test is going to be positive is very small. So we try not to test people within the first 2 days after they've been exposed to someone. So people tend to panic and they're like, well, I was exposed to someone yesterday. Why won't they test me? Because it takes a few days for the COVID-19 virus to build up in your body and to actually show up on tests. So if we test you in those first 2 to 3 days after the exposure and it comes back negative, that doesn't mean you won't develop COVID in the next 11 days. And that's why there's a 14-day quarantine period, because you could develop symptoms and or COVID anytime during those 14 days. We've had people be exposed, be asymptomatic, and on 13 and a half days, they become symptomatic and get sick and test positive for COVID. So the 14-day quarantine is very important, but it's also very important that we're able to identify who was actually exposed, because we've had these conversations. The biggest difference between COVID and influenza is that with influenza, you generally don't transmit until you start having symptoms. So once you have a fever and body aches, that is when you're most infectious with influenza, and that is when it's most likely to transmit to others. With COVID-19, you can have COVID-19, have no symptoms, and still spread it without knowing it. And so that is why it is so very, very important for people to adhere to the 14-day quarantine, because just because you have no symptoms after an exposure does not mean that you are not what we call brewing it in your nose or carrying it in your body or incubating it, and you can still transmit it to others and then develop symptoms and or a positive test later. And so what the CDC is trying to do, and I feel really bad for them, because the Department of Health is quite stressed. I cannot imagine being the CDC. The reason why they're doing the contact tracing instead of the local health department is, one, because he's the president, so he's a federal employee and he is covered under the CDC, but also because the exposure risk covers more than just his small circle. And usually what we do with an outbreak investigation, we look at first the group that was closest to the person that had the disease. And then if anybody ends up developing symptoms or testing positive, we'll move out from that and say, okay, well, who were those people around? And we'll test the next group and the next group. With the president, he was in so many different places and potentially exposed so many people, the CDC had to get involved. The contact tracing is just going to be a nightmare for them, because there are so many people and locations that they need to try and do the contact tracing on within the days before he was symptomatic and or tested positive. And so they will probably be doing contact tracing for several weeks going forward, just trying to identify who was potentially exposed, who may be developing symptoms. And the sad part is that during this contact tracing, you will have people who were exposed, who haven't been contacted yet, who will develop symptoms, who will have COVID, and possibly be spreading it to other people. And so this is what happens when we don't follow the guidelines. It's just like this mushroom effect, where you have it starting with one person, and then 5 people, and then 10 people, and it just spreads and spreads, and it mushrooms out into a huge problem for our own country. So hopefully they'll be able to contact a great majority of the people. It's been all over the news, so the hope is also that people who were in contact with him will do the right thing and do self-quarantine, even if they haven't been contacted. And then if they do develop symptoms, contact their primary care provider and or their local health department, so that we can just try and get a hold of this situation and prevent some of that spread and transmission.
So now the president has been discharged from Walter Reed Hospital and actually did an appearance and took his mask off. Based on your expertise as a nurse and infection preventionist, do you feel like him being discharged from the hospital was appropriate in terms of timing, or do you feel like it was premature given his age, comorbidities, etc.?
I can't speak to specifics about whether he should have been discharged or not. What I can say is that I was very surprised that he was discharged so quickly, and perhaps he's receiving the same level of care or close to the same level of care at the White House, and that is why they discharged him. But historically, when people are sick enough to need remdesivir and dexamethasone, they are not discharged quite as quickly, and especially with his age and his comorbidities. Generally, people tend to be sicker. And so I'm very surprised that he was discharged quite that quickly, but everyone is different. Everybody's body responds differently to the virus and to the treatments. And so, and we don't know what kind of care he's receiving at the White House. So perhaps he just transferred his care from Walter Reed to the White House. We don't know, but it was quite surprising to see him discharged from the hospital so quickly.
Definitely. And I think that's part of the confusion, is people are now questioning how exactly COVID is treated and what is the appropriate way to navigate hospitalization and your care after that, and that kind of thing. In our last town hall, for those of you out there who weren't able to join us 2 weeks ago, we did a conversation on Black maternal health, COVID-19, and medical mistrust. We talked about the vaccine for COVID-19 and the importance for people within the Black community to participate within the vaccine trials. Right before that conversation, I actually did a poll on my personal Facebook page, and I said, hey, Black people, how do you feel about participating in the vaccine trial? And every single response, every single one of them was absolutely not. I will not do it. Several of them saying, hey, this sounds like the Tuskegee experiments all over again, because there were 2 HBCU presidents who agreed to participate in the trial and were committing to encouraging their students to participate. And so we have our historical trauma and also our historical truth, right? Because the Tuskegee experiments were very real and disenfranchised our people on the basis of advancing modern medicine. And also, we had Dr. Zeke on our call who explained, and also you, Adriene, who committed to being a part of the trials and explaining that this is something that needs to happen within our community. So all of that being said, I want to ask Mr. Simmons, when we have historical trauma, how do we navigate understanding the truth about our history, coupled with the fact that there may be new circumstances which require us to do things that historically we normally wouldn't? I feel like that's a really strong internal battle for a lot of Black people, and we're having to question, do we trust our history and remain in that cycle, or do we do something new? How can one mitigate all of those concerns in a healthy way?
Oh, you just love giving me the hard question, huh?
Yes, because you got all the answers.
Okay. You believe that, okay? Well, the interesting thing is, to me, and I might be off the mark, is how we will conveniently follow something that will allow us not to do something. And that's a trauma response as well, right? I mean, we talk about Tuskegee, but there was so many other experiments that was done, especially on Black women. There was things done on Black women that we can't even describe, right? And we keep bringing up reasons not to do something. It's like the reasons not to, when I was working in chronic pain, the reasons I don't want to take my pain pills, but I want to, at that time, because marijuana was really illegal back then, I'd rather smoke my marijuana and lose my benefits because my drug test is bad and wouldn't do the other stuff, right? So the trauma response is when you refuse to deal with the full truth of your trauma, like how does it get in the way of you doing correct things, you'll always find a reason not to do something that you just don't want to do, right? That you're scared to put the effort in, right? Us not being involved with the trials on the front side is almost more deadly to us than doing it on the backside, because we have learned that certain medications, certain therapies work differently on us than it does white folks, right? And we have had white folks use that against us when it came to pain medication. They used to say we could tolerate more pain. Think about it. Our resilience, they use our resiliency against us. We can handle more pain than white folks. Doctors would literally say that when I worked in chronic pain. It's like, and that's the reason you're gonna not prescribe them the amount of medications you even the same level you were describing to white individuals for the same pain. you're going to say, well, they can handle more pain. Look at, and they would literally talk about the history of they were so blatant. They would even talk about the history of the pain that Black folks suffered, that they actually administered as white folks on Black folks to use against them, right? So part of our trauma response is sometimes, living in the moment. I don't feel comfortable, and that's okay not to feel comfortable. But the issue is get all the information, not pieces of the information. So, because they're going to come up with a vaccine, and if there's not enough of us involved in it on the front side, because some of us will take the vaccine, right? I get a flu shot every year. I got friends who refuse to get them, but I haven't had the flu in them years. I have taken the shot, and that's just the issue. But the thing is when we do eventually get around to doing the flu shot, and then we find out because we didn't have enough folks on the front side, and we end up with some real problems on the back side, then we're gonna have another excuse on not to do stuff, right? And so I know that might sound unfair, and that might sound like I'm trying to, talk negatively about us, but our trauma, our refusal to deal with our trauma and the response of our historical trauma has gotten in the way of a lot of things that we have sabotaged our own selves with, right? And again, if you really want to heal, you got to deal with the full truth, not half the truth, because you can't handle the part about how you understand that our trauma done got to a point that we don't even trust each other. We act like we kumbaya, but as Black folks, we don't trust each other. If we get real, but we ain't trying to get real. There's gonna be folks that, well, older folks, not the younger folks, because the younger folks, when I talk about this kind of stuff, they get it. The older folks my age and in their 40s, 50s, oh, he just being negative. I don't care. And I just don't care, because I'm in my basement doing my Corona thing and enjoying myself. Corona is like heaven for me in terms of dealing with people, because I'm, introvert and all this other kind of stuff, and I got everything I need down here. But the issue is we really, really got to really address our trauma. And now we got the new term, racial trauma, which is a trauma we share with every Black person. That's why when we see another Black person suffering, we feel it like it's ours. I mean, literally feel it like it's ours, on top of all this stuff, right? When we seen George Floyd down there, when I seen that man, that was like, I was down there, right? And we've been dealing with that, and then on top of that, we don't stay off of Facebook, and sometimes we rather believe what's on Facebook. And I'm not saying we shouldn't, but it's interesting, the things that will might move us to doing more healthy things, we have a tendency to shy away from, because it means we have to make some extra effort. And we got part of our community that's been surviving, and we see the response of just surviving, but we don't want to deal with that. We'll start talking about resiliency. But I talked to a young man because I got this men's group, and I asked him, what does resiliency mean to you? He said, Mr. Simmons, we still here. They ain't killed us yet. Living in the moment, right? Living in the moment. And when we was talking about Black men, a lot of times don't get no services until they're deemed perpetrators. So why would, because my guys all the time says, Mr. Simmons, why don't people send me to groups like yours before I get in trouble? I said, because they don't care, and you haven't learned how to care. So this is what we get. So see, you should let me stay on mute. Now,
No, once again, you hit on a lot of really, really great points. That's exactly why we don't have you on mute. And you hit the nail on the head of, a lot of times services aren't provided to people until their illness or their trauma has resulted in a bad behavior. But I think there are so many signs before someone becomes a perpetrator for them to receive resources, for them to get some help. And so I want to ask Brandon Jones, what are some of the signs that an individual should possibly be receiving some type of additional care or support?
Yeah. Well, that the answer to that question is very tricky for us because typically some of the signs are like your day-to-day functioning has changed, or you have extremes in your moods, or your sleep patterns are off, or you're eating less or more. But when it comes to Black folks, we eat so much trauma and pain, as Sam was just saying, that's our normal day-to-day. So it's hard to determine when somebody should get help. And it's not a clear cookie cutter idea for us because we deal with so much trauma. We even have language in our community saying things like it is what it is, where we don't really deal with it. And we literally used to call our culture the struggle. So we like Sam always says, we eat trauma like Skittles. Like this is just a part of who we are and what we do. So when we talk about, what are some of the signs, it is very objective depending on who you're talking to and what's going on. Typically what I try to do is I look at when I work with individuals or I'm working through a program and I'm saying, what is going on? Like what is constructive and what is non-constructive for you? And encouraging them to be very honest and open about what is working and what isn't. Because a lot of times we just assume that things are supposed to be the way that they should be. And we just take things as dysfunctional and we just take things and say, well, I'll just figure it out. But when you're able to have that raw, open, honest conversation and ask folks, what is actually working for you? What is not working for you? What do you want things to be? And then you say, okay, how do we get there? Is there a program or service to help you? Or are these things internally that you need to work on? And usually it's a combination of both. It's getting that support and that service, but then there's some decisions, some internal decisions that individuals need to make for themselves. And sometimes those decisions are hard because you have to start setting boundaries. You might have to stop, associating yourself with people or places. You have to start making some choices that are uncomfortable, that you might be a little bit unfamiliar with. And you might have to expose yourself to things that you normally wouldn't expose yourself to. And I think when we're able to encourage people to get to that level where they're taking a little bit of those risks, they're getting out of that comfort zone and they're getting in that growth zone and they're maintaining, some ability to be uncomfortable, but to continue to grow. That's when people start to see the change in their lives. So that's a very tricky question. And I think that is very individualized depending on who you're working with.
That's a really great point, that there is external support and resources that people can in fact tap into. But there is internal work that people have to be doing, whether it is yoga, prayer, meditation, eating better, not leaning into substances like drugs, alcohol, etc. And sometimes the person is the drug, right? So it's not being around certain people or abstaining from sex or abstaining from certain activities that were maybe making you feel good in the moment, but weren't necessarily leading you towards your healing. And it is a process, and everyone is going to look different. I do want to ask Dr. Z something else that Mr. Simmons touched on earlier was about Black women and the responsibility and the weight that we carry being the mothers, the caretakers, being the ones who receive the trauma sometimes from our partners. And then we have our own experiences that we have to navigate through. When you are a caretaker, when you are an empath, when you are the one who seems like you have so many responsibilities, it can be really difficult to prioritize self and to find time for your own healing, because if you drop the ball, everyone else's ball drops, right? Or so it seems. So how do you navigate holding a multitude of responsibilities while making sure that you prioritize your own healing?
All right. So again, acknowledgement is the key factor here, right? Because as a Black woman, we are expected to heal the world and do it gracefully. Like, I feel like a lot of Black women aren't given the grace or the opportunity to be vulnerable. Now we are starting to have those conversations. Allow Black women to have the same grace that you give our white counterparts. I'm like, okay, without going down the wrong direction, it's like, just give us grace. Give us the opportunity to be vulnerable. Give us the opportunity to be not okay, right? We need support sometimes. We need the grace to say, you know what, you need a break. Let me take some of this on. I can honestly say, like, last week was rough for me. My husband stepped in it wasn't even like I had to ask, he saw, like, what, your mood is down, you look very tired. I'm going to make dinner. I'll make sure that I'll get the clothes and laundry done. I'll make sure that I get the dishes clean. You just sit and do whatever you need, go upstairs and take your bath, do what you need, because, me showing up for me and our family, it impacts the energy in the family. It impacts the energy and how I show up for my clients. It impacts essentially everything. So if I'm not okay, I cannot be okay for you. I cannot show up for you. I cannot support you to the best of my ability. So allowing Black women the grace is really what is needed. Allow us to vent. Allow us to have our down periods. You can't heal the world and not show any kind of emotion. It's just not fair. It's not fair to have it all on us. And, we're starting to realize that, again, as I always say, it's okay to not be okay. We're offering grace to one another more, but it needs to happen on a larger scale. Don't beat us down because we dropped the ball one time in our life. Give us the opportunity to fall gracefully and help lift us up. That's the gist of it.
That's incredibly important. In fact, I had another one of our sisters actually sent me a text and said, sis, you've been through so much. Like, I hope you just have the space to be soft. I think Black women always get mischaracterized as the angry Black women. And what that does is it doesn't acknowledge the fact that for those of us who are angry, it's typically for a reason. And anger is a valid emotion. Nina Simone says anger is fire, and fire moves things. And we know that Black women get things done regardless of the social circumstances and the internal circumstances that we're facing, right? But we also deserve to and need to sometimes take off that cape and take off all of the responsibilities of everyone else, and to just be in our full humanity, which is saying sometimes I'm sad, sometimes I'm angry, or I'm tired, or I am frustrated, or I feel hopeless. I feel like 2020 is one of those years where a lot of people have come into contact with the feeling of hopelessness or despair that maybe hasn't been, because there's this pandemic that seems to just be completely out of control. We have had so much trauma as it relates to like police brutality, and then all of the other things that came with that. Even what happened in Minneapolis we not only witnessed the murder of George Floyd, we witnessed several neighborhoods just going up into flames. We witnessed white supremacists coming from all over into our neighborhoods and driving around at night with cars with no license plates and hanging shotguns out of the windows, and all of this just unrest within our community, where there's like real life PTSD happening within our communities. And it can feel incredibly hopeless when it's one thing after another after another. I want to ask Adriene, who works in COVID. She's an infection preventionist. So, this is another person who's just seeing the numbers continue to go up, and is also a Black woman, and is also a mother and a caretaker. How do you navigate not feeling like everything is just terrible when bad things continue to happen?
I don't, quite honestly. I used to try and not internalize the pain and the suffering and the despair, but I am an empathetic person, and so I feel everything. And so what I've realized is that I have to allow myself to feel it, give myself permission to feel it, and then figure out how to deal with it. And so, for instance, as a single mom, I'm trying to get my daughter through college, and I'm taking care of my son. And last Sunday, I just completely shut down, and I laid in the bed all day long and did nothing but watch mindless TV. And I don't do it often, but I had to give myself permission, just like I give myself permission to feel the pain and despair. I have to give myself permission to just let it all go, And I think that's where we as women sometimes fail, because we don't give ourselves permission to just let go and just do nothing or do whatever it is that makes you feel better. You know, sitting out on your deck in the sunshine for hours, just staring off into space is what you need to do, then that's okay. You know, you don't have to be doing and providing all the time. And I think as Black women, we feel like we do, and when we're not, we feel like we're not doing what we're supposed to be doing, or we're less than. And so learning to give myself permission to not be totally engaged, not be there at that high level all the time, and realizing that not doing doesn't mean I'm less than, it just means I'm not doing. You know, sometimes I think we attach more to our actions than we need to. And I had to finally realize I am still the same phenomenal mom, even when I send my kids to McDonald's instead of fixing them something to eat. You know, I am still the great coworker when I sit and stare at my computer for hours and then finally just shut it off and say, you know what, it's 5 o'clock somewhere, I'm going to sit here and have some orange juice or something. You know, and it doesn't change who I am at my core, but what it does is it gives me permission to just let go and let all that empathy go, let all that stress go, and really focus and internalize what do I need at this moment. And it doesn't mean that for days on end I'm going to be laying in bed watching TV, although I very easily could, but that's not what happens. You know, once I let go and I really let myself just do whatever I need to do to relax and find a really positive mental space, then that makes me even stronger. And I'm able to come back bigger, better, and more productive than I would have been had I kept pushing and saying, you know what, I got to cook them dinner. If I don't cook them dinner, they're going to eat unhealthy, and then they're going to die in early age because I didn't feed them healthy food. And that is not the case. They can eat McDonald's 5 days in a row and they will be fine. It's okay. And like Dr. Z said, it's okay to not be okay, and it's okay to let go. Just let go sometimes and do whatever it is you need to do to deal with what's going on, you know. And so that's what I do now, and I try to reserve that for either Saturday or Sunday, and I just take the entire day and do absolutely nothing. I don't care if my house is a mess. I don't care if the dog is begging to go outside and go for a walk. That day is all about me. I don't want to talk to my kids. And I'm like Sam, COVID-19 has kind of been an okay thing for me because I'm all right just sitting at home being by myself and not talking to people. You know, I do enjoy conversation, and I'm a very social person when I'm social. I'm okay not being social. So being home and being to myself is fine. But I did find that with COVID-19 and being home with the kids and the dog all day long was a bit much for all of us. And so my daughter, bless her soul, would just get in her car and just drive. And I don't know where she would drive to, but she would say, Mom, I just need a break from life, and I need a break from you and Ashton and the dog. And so I'm going to go and drive, and I'll be back. And so, you know, at first I would get angry, and I was like, what do you mean you don't want to be around us? You know, we're your family, and we love you. And where are you going, you know? And then I realized when she takes a break, I can take a break, you know? And so allowing ourselves to take those breaks are very important. And I think that's what has helped me to continue to do what I do and still be successful at it, because I am allowing myself to take those breaks, and I'm giving myself grace, as Dr. Z said, and just letting go and, you know, accepting things for what they are, but also giving myself time to let go of all of it.
Absolutely. You touched on so many important points. It reminds me of this quote by Tracy Ellis Ross that says, inside of my deepest and darkest moments, there is always a part of me that is always okay, and I can always access that part whenever I need. And so even when things are falling apart around the world and I'm sad about this thing, I'm stressed about this thing, I'm angry about this thing, there is always a part of me that's okay. and I can access that part at any time, right? And I thought of that because when you mentioned sometimes just watching TV in bed, I have been watching Girlfriends on Netflix, and that has been an integral part of my self-care practice over the past few weeks. And, you know, sometimes it really is as simple as just turning on the TV, not the news, because the news can be a little overwhelming, but turning on the TV and letting your mind just go to a different place, turning on something funny, watching things. Sometimes you do stare at your computer for hours and it's like, what did I accomplish? What did I get done? And being at peace with yourself enough to say, you know what, let me turn it off. Let me go for a walk. I will come back to this in the morning. That message doesn't need to be responded to. I am human. And I am not a bad person. If I drop the ball or don't get this thing done, I am human. And that's the reality, is we are all living in this pandemic. We are all in the middle of this uprising. We are all dealing with our own interpersonal conflicts and stressors, childhood trauma, historical trauma, and giving one another grace is just critically important to us being able to heal and to affirm the humanity of other people, is knowing that if I drop the ball, I know that Adriene will still hold space for me and not discard me and shame me. I know that Dr. Z will still hold space for me to just be human, which is what we all are at the end of the day. And so I want to start wrapping up this conversation, but I want to ask the mental health practitioners here, if you are someone who is watching this conversation and you're coming to realize, you know what, I think I could use a little additional help navigating all of this stuff that I'm holding, but I'm closed up, I'm guarded, I'm apprehensive. How can someone begin to trust the professional to suddenly hold all of the secrets that they wouldn't give their mom and their sister and their cousin? They've been holding it all in and haven't found a soul to trust with it. Now they're across the room from a partner, or it's telehealth now. So they're on Zoom with a mental health professional, and suddenly they're supposed to unload and open their deepest, darkest secrets. How do you prepare for something like that?
I'll dive in. Well, first, one of the things that I've done when I've worked clinically with folks is I set the tone and I build a relationship right away. I always tell people, if I'm going to get all up in your business, I'm going to let you get up in mine a little bit too. So I tell a little bit about myself, let them know who I am and what my approach is to clinical services. But I also share that therapy is not normal. It is not normal to go to a complete stranger and tell them all your deepest and darkest secrets. And I think when you're able to just kind of lay it out like that and be authentic, it helps bring that bridge down a little bit. You may never get to a place where you're trusting your therapist, but that's a process. It's not going to happen in one telehealth session. It might take 3 months for you to actually open up and tell exactly what's going on. But it's the clinician's job is to be with you where you're at and to work with you on it. It's not the job of the client or the patient to do that. Your job is to go get the healing and help that you need, and it's the clinician's job to make sure that they're building that relationship and rapport with you. And that anxiety that comes in, that those depressive symptoms that comes in, that fear, that anxiousness that comes in from your perspective, going into that space or being in that virtual space with that clinician is okay, because we are trained to sit with that and to work with that. So don't allow your uncomfortableness to stop you from getting the help that you need, because we're trained professionals to deal with that. And take that risk. And sometimes you got to get outside of that comfort zone and take that risk to get the help that you need. Because sometimes the things that you think that you got, that you can kind of deal with on your own, are bigger than you know, and they're attached to so many other things, and you won't know that until you're working with a professional who can help kind of tease some of those things out.
That's a really good point. And if people want to get help specifically at North Point, if they're interested in sitting down with you or other mental health, behavioral health practitioners, and they don't have insurance, can they still book an appointment? How does that work? Oh, you're still on mute.
Yeah, so if you don't have insurance, you can still get access to services. We do have MNsure staff present that can help you get set up with medical insurance so that you are covered. We do not turn people down right now. We are only doing telehealth sessions unless someone is at high risk And what we mean by high risk is like, you're suicidal or you're at a point where, things are just out of control. Then we will see you in person. What we're doing is we're doing over the phone, we're doing assessments for high risk. Otherwise, we can get you set up for a telehealth session with one of our clinicians. We see people, we have psychiatrists on staff, and then we have other licensed mental health professionals on staff. So you can see people to get things like prescriptions filled. You can see people with relationship issues or individual issues. You have your children seen, family dynamics. So we see the full range of services at North Point. And all you have to do is give us a call, and then we can get you set up with an appointment.
Perfect. And that number to North Point is 612-543-2500. Again, 612-543-2500 to make yourself an appointment at North Point, or just talk with somebody and see what services they offer, which do in fact include free testing for COVID-19. So make sure you call and get yourself set up with an appointment. Dr. Z, as we wrap up, there are so many things happening in the world right now, and it can be just completely overwhelming for anyone who is not feeling like themselves or maybe is on the verge of a breakdown. What advice do you have to offer them on just how to make it to the next moment, to the next day, next week? You're still on mute.
Here we go. I'm unmuted now. Acknowledge first that you're having an issue. And then the next step is deciding that you want to get support. And the support can come in the form of a friend. It can come in the form of your partner. It can come in the form of an impartial therapist. As Brandon mentioned, we're trained we set the tone for, what's going on. So, we'll ask guiding questions like, what's going on? How are you doing? What happened last week? We'll guide you through what you might not even think that is an issue, if that makes any sense. We'll ask probing questions that you wouldn't think to ask to kind of get through those blockages. So it's being okay with wanting to talk to somebody and then showing up as your true authentic self when you do get in front of somebody that can help and that is willing to help. Because sometimes we're very guarded and we only share information which we think is important. However, you're holding back on that main thing that needs to be discussed in order for you to heal inside so that you can propel yourself forward. So I always say, be okay with having, if you don't want to share your information, don't share it on Facebook to get your Facebook therapist. Get yourself to somebody that can help you cope, right? And a lot of times that is a therapist who will be impartial and who will guide you through healing. What you actually say and what you don't say, right? So that's my 2 cents.
That's important, what you say and what you don't say, right? Because there are some people who, even when they get into, their counseling session, they still don't feel comfortable to tell the full truth or to be honest about some of the things that they're experiencing or some of the things that they've done. And it's important to note that therapy is work. It's real work. Healing is work. However it comes, whether that's, meditation or sitting down with a professional, writing things out in a journal just to get them out of your head and out of your body and into, another location. It's work and it's not easy. And it does take some preparation and some honesty. And it shouldn't be discounted, like you give yourself cool points when you go to the gym and you work out. You got to give yourself cool points when you've done some emotional labor of some sort and you've done something to move towards your healing. I want to ask Mr. Simmons, as we wrap up, what advice do you have for our audience on just how to cope and move forward? There have been so many things that we've experienced just in 1 year, just in 10 months, really, that we just didn't see coming. And that can have the potential to have long-term implications on our mental, emotional, and spiritual health. So where do we go from here?
Well, there's not a lot more I could add that haven't already been said, but I think the biggest thing is really identify what you can manage that's really in your control, and not all the things you think should be in your control. That's two different things, right? Because there's a lot of things as a people, we have a tendency to be very codependent as a people, and that's out of our survival. Always being worried about everybody, and it's not just women, because men too in our community, because we're a collective people, which don't leave us much room for our individualized pain, right? And we have to give ourselves, we really, really have to have a real good talk about what is in our control, right? And share your information and realize you're not responsible for folks getting it, right? Because sometimes we share information with our family and they keep doing the same old crazy stuff over and over again. And then we feel more responsible than they do. And I gave that up 30 years ago. You know, I quit being grown for everybody else 30 years ago. And the ironic part, at the time it was painful and rejecting, because when you start taking care of yourself, family and our community have a tendency to turn on you. How dare you take care of yourself? You know, and that is part of the trauma. The trauma is not our fault, but the healing is our responsibility. So why don't we leave it with that one?
I love it. The trauma is not our fault, but the healing is our responsibility. And you're absolutely right. There will be healing that comes at a cost, you know, and that is, you know, the pain of setting boundaries, or it is the reality that you're now going to look at certain friends and certain family members through a different lens than what you've looked at them before. And it may mean that you don't spend as much time with them. It doesn't necessarily mean that you discard them, that you throw them away, that you cut them off. You know, I think that's gotten entirely too popular within our culture, is just completely cutting people off. But it is the acknowledgement that some people are at different places in their healing journey, you know, and some people have made the choice not even to start their healing journey yet, right? And when people cause us pain, when people do painful things to us, a lot of the time it's not even about us. You know, we are a bystander to someone else's trauma. And that's just the reality of how it works, is we haven't always been given tools on how to handle one another with care, with love, with respect, and with grace. And it truly is a process. But when you're healed, you can identify, you know what, this isn't about me at all. This is about this person and what they're still navigating through. And then you can respond accordingly on how to protect yourself and to how to lovingly hold space for someone who's maybe not as far along in their process as how you had hoped. So in closing, I want to go to Miss Adriene Thornton. We talked about a lot in this conversation today. How do you want to close it? This can be COVID related. This can be mental health related. However, Adriene is putting on a mask. So Adriene, take it away.
Can you see me smiling under my mask? I'm smiling with my eyes.
Smiling with your eyes, a smile.
So, continue to wear your mask, people. You know, we can make a change in how we transmit COVID, especially in our communities. Do your own research. You know, it's almost time to vote. And people need to vote their conscience, but they also need to do the research first. If you are not comfortable with the information you've heard about the COVID-19 vaccine, do your own research. As you said, I did sign myself and my family up for the vaccine trial. We haven't been contacted yet, but I hope we will. And that's because I am, as a medical professional, I am quite familiar with the processes that go into place for doing those trials now. And I will tell you that I know you guys have probably seen me wiggling through this entire process. And today has not been a good day for my legs and my feet, because I have what you call Raynaud syndrome, where my feet are always cold. It can be 80 degrees outside and my feet are always cold, and that makes my knees hurt. And so the story that's been passed down is that my grandfather or my great-grandfather was a part of the Tuskegee experiment. And the result of that is that everyone in my family has Raynaud's disease. Now, I don't know if that's true, but that's what, my mother told me, my aunt told me, that's what our entire family says, and so you have to go for it. So even knowing that there's this huge possibility that my grandfather and my great-grandfather were a part of the Tuskegee experiment, I still trust the medical community. Now, with that said, I don't trust people who claim to be in the medical community. There are trusted sources out there. And so I want to make sure that my Black people are represented in these studies so that we can figure out how the vaccine works for us, how it impacts our health. Is there anything that we need to do with the vaccine before we give it out to everyone before it hits the market? So if you haven't signed up for the vaccine trials, please do. And trust and know that the FDA will not release them before they get through the phase 3 trials. And we talked about the different phases of the trial last week. So just make sure you do your own research, learn about how vaccine trials are done, what are the different phases, where are we, which companies are actually doing all 3 phases, because there are lots of companies out there creating vaccines. And so if you're not sure which one to trust, you can research that. Reach out to Dr. Zeke from last week. He's running one of the vaccine trials here in Minnesota. You are free to reach out to me if you have questions. If you see me on the street, just grab me and say, hey, I have questions. We're here for you, but we as a people, we have got to at some point let Tuskegee go and move into trusting the system more to do what's right. And if you think somebody isn't doing what's right, then you need to report it. There are places you can report it. There are people you can report it to. There are so many things that we can do. But as Sam said, it's our responsibility. We can't rely on other people to give us our information, to do things for us, to make things happen for us. It's our responsibility to do it for ourselves, and that includes being a part of this COVID-19 response program. And so just always wear your mask, wash your hands frequently, and watch your distance.
Absolutely. Thank you, Adriene. That's an incredibly powerful testimony about how we can experience things from one generation, but what's happened to our elders and our ancestors doesn't necessarily have to be our plight, and we can be a part of moving the needle forward in terms of the way in which our people receive medical treatment and care. So thank you for noting that. Thank you to all of our panelists for your time and your energy and your wisdom. This was an incredibly powerful conversation. Thank you to everyone who's watching, whether it's on Zoom, on Facebook Live, or on YouTube. I want to encourage you, if you haven't already, go back and watch the conversation from 2 weeks ago on medical mistrust and COVID-19, as well as Black maternal health, and to join us next week. We actually have added an additional conversation into our schedule. It is happening October 14th, same time, 11:30 to 1 p.m. right here on the African American Leadership Forum Facebook page. And we are talking about the upcoming election. We're talking about getting civically engaged, making sure that you have the right information, making sure that you keep yourself safe, because we are still in a pandemic and everything that comes with it. So I want to encourage you to join us. And I also want to give a very special thank you to our partners and our sponsors, North Point Health and Wellness, Children's Minnesota, Insight News, the Minnesota Spokesman Recorder, as well as Minnesota Community Care. My name is Brittany Wright with Insight News, and it has been an absolute pleasure to share digital space with you. Please take care of yourselves, honor your mental health, and do whatever you need to do to honor your full humanity. Have a great afternoon, everyone, and we'll see you next week.